superior and inferior vena cava. Absolutely.
Where?
So superior and inferior vena cava, which is where the blood comes into the right atrium from the brain and from the rest of the body. Right? Okay. So next we're going to do the pulmonary trunk.
Let me ask you a question.
Pulmonary trunk.
You tell them what that is? A little stick?
A little hole.
Stick?
Is this?
Point to that little red hole.
Okay.
What is
so
that?
this.
So the foramen ovale? No.
No. This is the opening of the coronary sinus. See the coronary sinus down here? Which is where all the veins collect, and remember they go straight into the right atrium. So this is the opening of the coronary sinus, and this is the fossa ovale that used to be the
For the baby?
foramen. Yes. The indention is the fossa ovale. This is the opening to the coronary sinus. Absolutely. Okay. What do we have next? Okay, so ligament arteriosum. On this model, it's that white. Okay, the right and left pulmonary arteries. So it goes to the lungs. So it's the blue because they're going to the lung. So your right and your left. Because this is your posterior view, so it would be anatomical. So this is right and this is left pulmonary arteries. And then the right and left pulmonary veins are going to be, right and left pulmonary veins.
That's going from the lungs to the, is that right?
The veins, from the lungs to the...
Remember, because when it comes back from the lungs, it's oxygenated. So this is going to be which system is that? The pulmonary circuit. Remember, because it's the opposite. Because normally the arteries are red and the veins are blue, but to the lungs it's opposite. Because this is yet to be oxygenated, and when it's coming back, it's oxygenated. But everywhere else in the body, it's going to be opposite. Like, this will be... Anyways. Oh my God. I'm not a good teacher. Okay, so we did right and left pulmonary veins. Okay, right and left atria. Okay, right and left. So the right atria we can see, and the left atria is underneath, and we cannot see it.
Oh, but in the other model we can see it. Right?
Can you? Right and left? Perfect. Okay, good. Okay, and then the right and left ventricles, and then the right and left auricles.
The auricles here.
Yep.
They look like wings.
Yeah. Okay, the apex.
Okay, it's just here.
Okay, right and left coronary arteries.
This is a different picture. So the right, this one, right? And the left.
Yeah, the left. Yeah, the left you can't see, but yeah.
This one is the continuation, right?
And it branches. It branches over here and here. Because this ends up. Okay, so I'll show you when we get there. So where's the coronary sinus? Absolutely.
Coronary sinus.
Okay. The atrioventricular groove.
Atrioventricular.
It's right here.
Oh, groove. The groove is here.
Yeah, the atrioventricular groove is there. The circumflex artery. Now that's right here, and this also comes off the left artery. That's why I said it splits, because here's the left coronary artery. We can't see it. It comes here and here. This is the circumflex right next to where the coronary sinus meets is the circumflex artery. Okay, the anterior intraventricular artery.
Intraventricular here, right?
The blue.
Oh, the blue.
No, the red.
Where this
Or is it all together? No. Okay, wait. Arteries are going to be red. Okay, so yeah, it's the red.
So where this splits? Because
Melissa,
It's in this bucket.
anterior intraventricular artery.
Right down the middle of the anterior intraventricular groove.
This one? But the groove I thought was over here.
No, that's the atrioventricular. Yeah, not the anterior.
Okay, anterior atrio.
There's atrioventricular and there's anterior interventricular.
And I look at it as because it has part atrium and part ventricle in it, so you know that it has to be over
The
And
atrio.
the other one just has ventricle, so it divides two ventricles.
Okay, so interventricular atrio. I see. I didn't realize that, so this is good that we're doing this. So this is the anterior intraventricular artery.
which one, the red one? Yes. Okay. The the whole thing here, the branches out.
Okay, the arteries, remember, okay, the arteries are going towards something, so they're going to be red because they're going to be oxygenating, except in the pulmonary circuit. Ignore the pulmonary circuit. So the arteries are going to be oxygenated because remember the veins are the ones coming that are deoxygenated. So the veins are the ones that are returning to the heart and the arteries, but this is of the heart.
Of the heart, yeah.
So this one's going to be the artery, the red, right? And the veins will be blue, right?
So that.
Because the only exception is the pulmonary circuit.
Okay, so specifically, which one is anterior interventricular artery? The whole red.
The whole red.
The main one, the big one.
The big one. Okay.
The big one. The big one. The big red one right here, right down the middle. Okay. Anterior
Interventricular sulcus.
is the groove that it's in, is the sulcus.
It's the line.
See, and then atrioventricular groove was over here. See, so that was the atrioventricular. And then the intraventricular is in front.
The great cardiac vein.
The great cardiac vein. Okay, so I believe if this was the artery, then this is the vein. But let's look in the book. Let's double check that. Where's the great cardiac vein?
45.
Okay.
So tendinous cord.
Yeah, so that is the great cardiac vein. This big purple one. Which, see, it branches, so it would be any of this. But it's mainly this one, right? Okay.
And the marginal artery.
The marginal artery. Trying to remember.
It's on the right.
Is it pointing to the red one? Okay, I do remember now. So the marginal artery, it's this one that comes down.
That was great.
The one that comes down.
See, because it's not the first one, but it's the second one that comes down off of the right.
His haircut too.
Now, would that be correct that the marginal artery would be the second one
Yes,
coming off
correct.
of? Okay. So, because this is the right coronary artery, and then the marginal artery is what comes off.
Where's the
of that.
left coronary artery on that one?
It's underneath.
Correct.
And does
Can't
it
see it.
bifurcate? Does it go into
What's
the
that?
what's the word? What's the word?
What is that?
Sinus.
The circumflex artery. Oh, that one's not the circumflex.
Yes, it is, right there.
Oh, I thought this was the circumflex here.
Well, it's
Or both.
don't yeah.
Okay, so this is the circumflex.
And what's this?
That's the
Anterior
Anterior interventricular.
Now, can I ask you something? Does the circumflex and the anterior both come off of the left coronary artery?
Yes.
Right? It just it
bifurcates
splits.
into
It
two.
bifurcates.
And there's a picture
Okay,
in
that's
your
what I
book.
thought.
Look,
Okay.
the book's got a beautiful picture of it right here.
Okay.
Look at that right there.
Bifurcates.
Okay. So the left carotid. Okay, yeah, the circumflex, and then the great, or the anterior. Okay.
This is the great.
So there's the anterior ventricular, and then yeah, the great cardiac vein. So yeah.
So
Okay. Okay, we're almost done. We're almost done. I think that was the
what's the
confusing
great
stuff.
cardiac vein again here?
Okay, the blue one is the great cardiac vein, and then the artery
The anterior.
is the anterior intraventricular.
Coronary artery.
Good God. Okay. We're getting there. I needed this review. Okay. And we did the sulcus, we did the vein, we did the marginal artery. Wait.
Marginal
Okay.
is the.
It's this one. It's the
Oh,
second
yeah,
one that
the
comes
second
down
one.
off of the right coronary artery. Here's the marginal, so it's the big red one down here.
And the fossa ovalis.
Okay.
That's one.
We know where the fossa ovalis is. Do you know where the fossa ovalis
It's
is?
a calcified foramen oval, right?
Yeah.
Okay.
Okay.
Fossa ovalis.
Okay, now here's the good one. The pectinate muscles.
This one.
Yeah, so the pectinate muscles are in the atria, in this right atria, okay?
Oh, just in the atria.
Just in the atria. Okay. So then when we get to the, we'll skip the valves real quick, because the trabeculae carinae, because we were a little confused, the trabeculae is only in the ventricles, where the pectinate's only in the atria. Okay. So then the valve. Where's the bicuspid valve?
Bicuspid valve. Right here.
Bicuspid is in your right ventricle,
Oh, it's not in
and
the
the
left.
tricuspid is in your left.
So two here.
Oh
and
no! Tricuspid, yes.
Yeah,
Sorry,
the bigger
tricuspid.
one,
No, no, you're absolutely right. I'm sorry.